Well, thanks so much. It's great to be here. It's great to see so many of you in the audience, so many familiar faces, a lot of new faces, which is fantastic. It shows every time I come to these conferences that the direct care movement is growing. And it's great to see everyone here. My name is Neer Patel. I'm co-founder and CEO of DirectMed DPC, which is a DPC practice that I helped my wife, who's a family physician, Dr. Katrina Iqbal, start 10 years ago in Austin, Texas. And we've now grown that practice to be one of the largest DPC practices in Central Texas 10 years later. I also, 5 years ago, started Virtuous Benefits, which is a full-service DPC benefits agency that creates health plans around DPC and with no network restrictions, so basically all the greed removed. I started that business with Angel Salcedo, who's here in the audience, 5 years ago.
I'm Dr. Travis Simmons. I'm a direct primary care family physician down in New Braunfels, Texas, which is a little bit south of Austin. And I was the first doctor to join DirectMed that helped them to open a new location. So they had primarily just been in Austin before that, and then they expanded to New Braunfels, and I helped them to spearhead that. And of note, I also do not have a ponytail anymore, which I realize I probably need some updated headshots, but yeah, next time. All right, let's see if our little slide thing will work. Yeah, so we just wanted to start by telling a little bit of the story about how we met. So I was in residency here in Denver, and I had a colleague who was in my residency class and was just absolutely like a relentless advocate for DPC. And I was like, man, I'm just trying to survive intern year. Can you like stop talking about direct primary care, please? It was Brad Brown, and he convinced me over the course of 3 years that direct primary care was the way I should go. And so, I think in the DPC movement, a lot of the doctors I hear from are doctors who have like been in the system for a long time and then switched out into a DPC model eventually. But like Brad, I jumped into DPC straight out of residency, so it's a very unique experience. And I'm also an employed DPC physician, so not a practice owner, which I know is kind of a minority here, but I think something that is going to be more and more common as the movement grows, and doctors like me don't necessarily want to like reinvent the wheel, and they want to join a practice that's established and thriving. So I heard about DPC from Brad, and then as I started researching it myself, I was listening to podcasts like My DPC Story, which is amazing. Thank you, Mariel, for the work you do, and for so many of the doctors who've been on those interviews. That was hugely influential to me as a new DPC doctor. And I heard an interview with Neer and his wife, Katrina. I said, oh, I'm going to work for those people someday. And so I wrote a little email, and then I'm sure I got called to like go deliver a baby because I was still in residency, and I like put the email to the side and I didn't send it. And then 6 months later, Brad sent me a screenshot from the DPC Docs Facebook page and was like, hey, those people in Austin you liked are hiring. You should like email them. So I just went and clicked send on the email, and he called me within an hour, and we chatted for an hour, and pretty much the rest is history.
Ironically, we weren't hiring for the location that Travis wanted to be in, but I am super thankful that he sent that email and made that phone call. Dr. Travis has been an amazing asset to our practice. We knew in our guts immediately when we had a conversation with him that he's a super compassionate, genuine physician that wants to take great care of patients, and that's all you need in this model. And so for us, we were like, we need to bring him in. He wanted to be in New Braunfels, Texas, which is about 2 hours away from where we started our practice in Austin. And that was a growing area, a growing town, and everything kind of works around the right physician. And so Travis helped us create a whole new practice several hours away from kind of where we originally were and planned to be.
Yeah, and it's been a privilege. I have really loved it. I got to learn a lot from you guys in the first couple of years that I've worked for you, and one of those things that you guys are very specific about in starting up a new location, I experienced this in my location, and then you guys have since replicated this again and again. You guys have a very specific set of things you're looking for when you open a new new location. So tell me how you guys do that and how you keep things lean to pass along those savings to the patient.
Yeah, so we run our practice very differently from most traditional DPCs or traditional medical practices in general, as far as I don't feel like we need to pay for a bunch of overhead or a bunch of space that we necessarily don't need. So every single one of our offices, we have 4 offices, they're all subleased inside of another practitioner's office. Different specialists in the area that have space available. And it really becomes an amazing symbiotic relationship because the specialists enjoy our referrals and we get, a great space that's affordable, that kind of has everything already ready for us just to move in and get started. We can use the staff at the specialist office for the occasional chaperone that we might need for a sensitive exam. The rent is extremely affordable, and we generally just look for oversized rooms with good natural lighting. That can be the physician's office space and exam room, and so that's kind of how we've done it. With low overhead.
Yeah, Katrini's big on windows. That was always a must. We'd see a space and she'd be like, "There's no window. We're not doing this one." Right. A big part of how we function comes back to our virtual medical assistants. Will you tell me a little bit about y'all's journey into hiring your first virtual medical assistant?
Yeah, so Katrini and I, for the first 5 years, we started the practice. We had 2 babies immediately. And so we grew the practice slowly by design for the first 5 years. We were doing everything ourselves. So she was obviously seeing all the patients. I was doing all the back office things and all the support things. And really when COVID hit, that's when things started to change for us, where we're like, we need to hand off some of these responsibilities. I need to focus on growth. We're bringing in our second physician at that time. And so we knew we had to kind of hand off these, non-medical responsibilities, but we weren't sure how to do it. And we had learned about some of these agencies that provide healthcare virtual assistants located in the Philippines. We're a little nervous about going down that route, but we decided to check it out. And so we looked at some of the agencies, HelloRach, 360 VMA, and started getting candidates. And interviewing them, and we found Riza, who was our first virtual assistant that we brought in from HelloRach 3 years ago, and she was absolutely incredible. Amazing English, very, very good. She's a nurse by education in the Philippines. Very, very good at what she does. And so I decided, let me train her really, really comprehensively, because if I'm able to train the first one really well, then that's going to pay dividends in the future as we grow and scale our practice. Riza will be able to help us hire and train the rest of the VA team. And she's just been phenomenal at everything she does. We've scaled up the team now to several virtual assistants. Riza has been instrumental in helping us do that. So it's been an incredible experience. And these, the cost of these virtual assistants, it's really a win-win situation for everybody. You get them for around $8 an hour, which is a very comfortable living in the Philippines. Riza's supporting her entire extended family with that salary. She's extremely grateful for the work, and she loves the fact that she gets to work for a DPC practice, because a lot of her friends are working for very busy, chaotic insurance-based practices, and they tell her what it's like over there. So she's super grateful.
Yeah, I love that you're giving Riza a shout out by name, because she's not listening, but I'm gonna have to tell her that that you talked about her for 60 seconds or more. She really is fabulous, and she helped to train the assistant I primarily work with, Jan, who has just been, just kind of echoing what you said, like they've been very seamless to work with. My best medical assistant experience by far in any of the practices I've worked at. Just very quick and thorough and on top of things. So it's been great. Phil alluded to this in the intro, but we recently had the privilege of hiring our 7th physician, Dr. Beth Just, who's been great. And y'all, I think from the start of talking with her about joining to her actually seeing her first patient, that was like a 30-day window roughly. How did you guys do that in 30 days?
So Dr. Just, we knew her originally as a DPC patient, and then she decided to go and work at one of the big hospital systems in town, Baylor Scott and White, in one of their primary care offices. And she did that for several years, and then just called us one day out of the blue and said, "Hey guys, I am super burnt out, and I would love to know if there's any opportunity for me to come back to DPC in a physician capacity and work for you guys." And we knew her already. We knew her personality was the perfect fit for DPC. She's just amazing with her patients, delivers incredible care, and was just handcuffed right by the system. And so for us, it was an automatic yes. Like, we would love to have you join us. And so we got to work. She didn't really want to take a break or take any time off. And so we got to work and really, really went quickly. I called around to several specialist offices and found a direct care physical therapist who had a 180 square foot room in her office that was going unused, amazing, huge window with nice natural light.
The window.
And so we just decided, let's do this, and so we subleased that space. We got our exam table, got all our furniture. We just replicate, the exact same space we have in every other office. Got our medical supplies, our EKG, and we were up and going literally in 30 days from the time Dr. Just told us she wants to join us until she saw her first patient.
Yeah, pretty impressive. Pretty impressive.
So Travis, you've been getting a lot more involved in helping us grow the practice, which has been fantastic. I love the fact that you want that additional responsibility, and you've been helping us with growth as far as recruiting new physicians. Tell us what that's been like from your experience.
Yeah, I think that's been a kind of natural extension of just my love for primary care and networking generally. So, like a lot of us, I've been involved in my local medical society, involved in the local chapter of the Academy of Family Physicians, and just recently got appointed as a adjunct professor at my alma mater. Woohoo! It was just some paperwork, but I'm excited about it anyway. But I'm really excited to start working with some of the medical students there. And since I was in medical school myself, I've just had this heart for I want to make primary care sexy again. To be honest with you, because it's not, but it can be. It can be. And I have learned that. Time and time again in direct primary care. So, getting to get in on the ground floor with a medical student who's still on the fence, and their professors are telling them they're too smart to be a family doctor or a pediatrician, and I want to kick that specialist in the behind. Getting to get on the ground floor with those medical students and be listen, direct primary care, you can practice at the top of your license, do all sorts of stuff you'd never have time for in a typical primary care practice, have time with your patients, be the idealistic doctor, the doctor you dream of being now that would normally be beat out of you by the time you are in the system for a few years. You could be that person all the way through your career in DPC. So, I'm on a mission there, and just as a natural extension of that, we're telling people about what we do and about our practice, and so we're generating some interest. There's been a lot of receptivity at some of the local residency programs that I've spoken at, and I'm working to speak at, just asking them hey, do you have any interest in hearing at your didactics about a different business model for primary care? And there's been a lot of interest. So that's been super fun, and it's easy to sell something that you wholeheartedly believe in. So that's easy peasy.
Another relationship that we've made over the last couple of years, and a great friendship, is Dr. Phil Boucher. We met him at a DPC conference, I want to say 2.5 years ago, and you had joined us at that conference, and we all sat at the same table together with Phil. And I know you were kind of you had just started with us, and so your growth was a little slower than you wanted it to be. And I think, Phil had kind of talked to you about some of the video marketing that he does, and helped give you...
Yeah, super uncomfortable with.
Helped give you a little more confidence in that area.
Yeah.
Tell us about that experience and how that has helped you grow your panel, as well as how that's helped you mentor our newer physicians on doing some of those things and getting themselves out of their comfort zone,
Yeah.
and how that's helped everyone grow their panels.
Well, we didn't mention this earlier in terms of keeping things lean, but we do a lot of the marketing ourselves, and so it comes down to the doctors like getting out and meeting people at networking things. But you do a ton of work on Facebook with marketing us in local groups, and having those videos for us of the physicians in our practice that you can post on those Facebook groups has been huge. We use that on Instagram as well. And I took a course from Phil that was super helpful just in building out like a little 60 to 90 second video for Instagram or TikTok. And he kind of goes over a template for how to do that, and went into some really practical, detailed stuff on how to use the actual platforms. And to the point now where I can generate a video in maybe like 10 to 15 minutes, and I'll often sit down and do several of them kind of all in an hour. But yeah, that was hugely helpful. And then I've been working with some of our other doctors who are a little more hesitant to do that kind of thing, just on how easy that is or how doable it is. Changing subject just a little bit for the second part of our talk, I wanted to get into a little bit more of the insurance side of things that you do with your partner, Angel Salcedo, who's in the audience here over at Virtuous Benefits. In 2019, you decided to go get an insurance license and to start recruiting employer groups. Can you tell me why you did that, kind of what that process was like, and then tell us about Virtuous, like what you guys do over at Virtuous?
Absolutely, yeah. So like many of you in the room, when we first started our DPC practice, I was trying to sell a membership to employers. And I found myself, kind of going in circles, chasing my tail doing that, because they were always most concerned about what happens with the hospitalization and the cancer and the big surgeries and these expensive medications. And I never really had a good answer for that. And most DPCs that I've spoken to don't generally have a good answer for those things. And so I decided, I really need to learn more about insurance and figure out if we can build DPC into it somehow. I started to try to work with some brokers myself, and quickly realized that, they don't want to work with me. They're not incentivized to lower the cost of their clients' healthcare spend. And so once I realized that, I was like, I've got to do this myself. And so I dove into the world of insurance and just started learning everything that I could about it, and got licensed, teamed up with Angel, and we created Virtuous Benefits 5 years ago, really with a mission to help, our own practice and all the other DPCs around the country that are having these same problems, that want to work with employers but don't really know how, and know how to have those conversations, do those things. And so within Virtuous Benefits, we essentially are simplifying the entire world of healthcare, or health insurance, really. So we are creating level and self-funded health plans that completely remove all the greed, and the way to remove the greed is to remove the network, right? So Blue Cross, United, Cigna, Aetna, Kaiser. When you remove that network completely, now you have no obligation to pay these contracts that you have no legal right to ever see what they say, and you don't know how much of that money is actually going to the insurance company versus going to the physician or the practitioner. And so when you remove these networks, you completely simplify everything to the point where you can literally pay the cash price for every single healthcare service that somebody needs. That, it's basically all the same healthcare that people are getting right now, we can pay the cash price for, which is 10 to 20 times less, as you guys know. And then we build DPC into every single health plan that we build, for all the obvious reasons that you guys know. And when we do those two things and combine those two things together, now the employer's in the driver's seat, they're making all the decisions, they control their own destiny, and they're saving astronomical amounts of money.
Yep.
Travis, speaking of employer groups and Virtuous Benefits, you've been a huge asset to helping us grow Direct Med and Virtuous Benefits by recruiting employer groups within your area. Tell us about that experience and how that's been going and how you create those relationships.
Yeah, fair question. Well, I'm out like at Chamber of Commerce events and things like that, and trying to meet people who might be retail patients eventually, but sort of in the process of doing that, I'm regularly meeting business owners, and they're regularly asking me kind of the inevitable questions about, you know, the things that DPC doesn't cover. And it's been really satisfying to me to have a partner that I know I can easily like pass these people off to. I think the primary care doctor in me has sort of come through in those relationships too, because we love continuity of care. And I'm like, oh, like they're meeting with Neer and Angel. I want to go meet at that meeting too. And you guys have invited me. So I've gotten to be at several of those meetings with the employers, kind of, convincing them like what you guys do is real and powerful. And then with the employees, like during the enrollment meetings, excuse me. And that's been just really fun to, as a DPC doctor in the room, to sort of provide that authentic experience of like what they're saying about DPC is very real, and it really can provide all this value. And let me give you like a few stories from this past week of, you know, what I did as a DPC doctor. I think we have incredible power to help a benefits company like yours to really sell what it is you're selling, you know, like to provide that authenticity. And it's easy to sell a product that I like really firmly believe in. So,
one thing I think that's been super helpful for us in creating those relationships also is asking very specific questions on your enrollment form, not just for like employers, but for everybody that joins your practice, right? Are you a business owner with W-2 employees? Do you offer health insurance to your staff? Would you like to learn how to lower the cost of your health insurance year over year? And that way you know exactly who's in your practice. You don't go and try to sell something to them right away or try to sell something to their company right away. You make them love you and DPC, which I think we all know takes, you know, a month or less. And then once you've done something great for them and they're like, thank you, doc, so much for this or that, that's when you gently, you know, kind of mention like, hey, I know you've got a business, I know you have employees, you offer health insurance. I'm not sure if you're aware, but we can actually show you a roadmap over the next 5 years of how to lower the cost of your health insurance every year and include my practice for all of your employees. All of that is going to be less than what you're paying Blue Cross right now.
Yeah. Now, you guys have worked with several employers in the area that I work in New Braunfels, but you and Angel have also worked with several employers from around the country. Tell me about how you've met those employers.
Absolutely. So we at Virtuous Benefits, we work nationwide. We work in a plethora of states all over the country, creating these health plans, and all of it is centered around DPC, right? So we're not going and trying to sell these health plans to employers directly, because that's just going to be an infinite sales cycle that is just going to have you spinning your wheels. If an employer has no experience with DPC, it's super hard to try to convince them that this is the way to go, because you're asking them to fire 3 important people in their lives, right? Their insurance-based PCP, their insurance network that they've probably used for years, their insurance broker, who's probably their friend or somebody in their community that they've known for a long time, right? You're asking them to fire those people. And if they have no experience with DPC, that's not something that comes easily. So we have taken the approach of educating DPC physicians all over the country as much as we can. We speak at, you know, as many of the conferences and speaking opportunities that we are able to obtain. I talk to a DPC physician probably every single day, at least one.
It's true. I've driven in the car with him, and I'm like, oh, another phone call. All right, yeah.
And yeah, we just educate the docs that there are insurance plans out there that can be created that work for the people that are using them and the people that are providing the health care. And once you see that world and see that all can be melded together, now you have something super powerful that not only saves a tremendous amount of money every year, but it also gets everyone the best care they've ever had and access they've ever had. Yep. Travis, so as we talk to more and more DPCs around the country, many of them have had concern about I'm not sure if I want to be built into a health plan. I'm not sure, like, I don't know how your payments are going to work. I don't know if this is something that I went to DPC because I wanted to get away from, being built into a health plan. So tell us what's been your experience with, sort of being built into a health plan as a DPC physician, and being, sometimes paid by the health plan.
Yeah, fair question. I think it's a natural hesitancy for us to have as physicians coming out of a situation where we were our reimbursement for our services was held hostage by insurance companies on a regular basis. So I think in that way it's kind of a trauma response for a lot of us. But it's been honestly like very seamless. The TPA that you guys use puts a credit card in the system for all of their patients that are patients at our practice, and we just run that charge like normal. And so I'm getting paid the same whether it's a retail patient or a patient from Virtuous. And it's been very seamless. And I think from a DPC standpoint, it's kind of an inevitability if we want to work with employers on a regular basis, because those employers are going to want a one-stop shop where they can reach out to their benefits company, and the benefits company will handle the payments to everybody. Those employers don't want to be paying everyone separately. So I think we need to embrace it if we can find groups that are good to work with or easy for us to work with.
I want to give all the credit for these virtual cash cards, essentially a credit card that we can give members to use, to Russell with Yuzu Health, who's also here in the audience. It's been incredible. We literally can just generate a credit card ourselves with $300 on it, and it's in the members portal, or we can email it to them as well, and they can just go to their cardiologist visit, tell them they're a cash patient, pay with our credit card, and it all runs through the insurance on the back end. It's been incredible. So that's all we have for you guys today. Really wanted to thank everybody at Hint for allowing us to be here. To everybody that's, all the DPCs that are here, no matter where you are in your journey, we want you to know that Travis and I are both here to help you in every way that we possibly can. So please find us, get our cell phone numbers. Our website's directmed.care, virtuousbenefits.care. We'd love to help you guys also work with employers if that's something you're interested in. And we also love to see not only physicians here now at this conference, but benefits folks, tech folks. Like, it's amazing that like all these people that are doing different things in the direct care world are coming together at conferences like this and really collaborating to make a difference. Thanks so much, everyone. Really appreciate it.